inspires me about what I do is that even in cases that are very challenging, where movement for the child getting through their issues may be very difficult, and where we may see very little movement, is that I know that we're planting seeds for the future, and that we can see those seeds possibly grow into new ideas and new ways for that child to be a happier adult. I'm Dr. Bob Batterson, and I am a child and adolescent psychiatrist. I'm the chief of the child psychiatry program at Children's Mercy, Kansas City, and I also run a Tourette clinic at our Northland location. I have a very collaborative approach to patient care. I try to make sure I have a very comfortable relationship with the child or adolescent so that they feel comfortable talking to me about their problems and issues, and that I can ask them questions to help me better understand what's going on with them. And then I also want to understand from the parents' approach what they'd be comfortable with as far as treatment. I like to offer parents options for medications, not just one pathway, if more than one pathway exists, of course. And then we together decide what we're going to do as a team to help their child or adolescent. Mental illness in children is relatively frequent, with around 1 in 5 children having a mental health issue during some point in their lifetime. Finding a connection point with children and adolescents can be a challenge, and then when you add on the other factor that those individuals may have a mental illness, it could of course present an even bigger challenge to try to figure out how to connect with them best. I like to start out with a lot of questions about what they like to do outside of school, what makes them have fun, what makes them smile. And then also, of course, based on my knowledge of working with kids for some 28 years now, that I try to call on that to figure out, based on some things the child is giving me, what might really click. I try to reflect what I feel like is a true and honest interest in children and how they feel and what they're thinking, and I really want to get to know them as a person. Over the course of time, we do see a lot of improvement in people's mental health when they have issues and they need help. I've had an opportunity here at Children's Mercy to follow some of my patients through pre-adolescence into adolescence and on into early adulthood. And watching them grow and change through time has been a delight.